COVID-19 pandemic has reminded all of us about the critical importance of primary care in every community. I'm Jennifer DeVoe. I've been a family physician, primary care team member, and researcher at Oregon Health and Science University for 20 years and chair the Department of Family Medicine here at OHSU. And I had the great privilege to publish a recent article in Mayo Clinic Proceedings entitled "Getting Primary Care, a Life-Saving Intervention, Off Life Support." And this short article was inspired by individual experiences that I've had with patients over the years in being a part of their lives, in contributing during good times and bad to decisions they've had to make about their health. And in the case of the patient I highlighted in this particular article, in identifying a small change in health that was a signal to a much greater problem. This talks about one of my patients who was a spry elderly woman in excellent health, who I knew quite a lot about her history and her active lifestyle, and saw her for a routine visit and noticed that she was getting significantly short of breath, was able to identify that she had a cardiac condition, get her to our cardiology team, who stented an artery in her heart, and from her perspective, saved her life. So when I was able to see her after the procedure, she said, "Thank you for saving my life," which is not something that primary care teams hear very often, because we're on the front lines, we're working day in and day out in communities, doing a lot of work in partnership with public health and preventive medicine to keep people healthy. There are times, however, when our presence in the community and in the lives of our patients does save lives, does improve health. And so this article was inspired not only by this individual experience, but an article that came out recently by colleagues of mine showing that primary care as an intervention in a community reduces the preventable rates of mortality and increases life expectancy for those people in the community. And then it was juxtaposed with a lot of messages I was hearing nationally about primary care perhaps being outdated or old-fashioned, and that in the future, primary care teams would be replaced by smartphone apps or out-of-state telemedicine providers or urgent care kiosks, all of which are interesting innovations in medicine, but in my opinion, certainly not a replacement for our primary care system that saves lives and improves the health of communities. And so in this article, I've walked through, and especially given the lens of COVID-19 and the pandemic that's with us today, I've walked through some of the areas where primary care is at this point on life support. COVID-19 has been a stress test, and it's shown us how fragile our primary care systems are and how antiquated many of the ways we deliver care and pay for care have become. And so there's 7 basic recommendations, and I'll run through those very briefly right now. And overall, the first immediate recommendation is to keep primary care afloat. The fragility and vulnerability of the system has been laid bare with COVID-19, and so many primary care practices and primary care teams are currently closing or going out of business or threatened. So we need to act immediately to keep them afloat. And then in the medium to long term, we need to look at first, accelerating all of our healthcare delivery transformation activities to really focus on all health systems being accountable for providing high value care. One of the things that the Mayo Clinic system does extremely well and prides itself on. Number 2, thinking about how to shore up the foundation of primary care. It is a comprehensive system. It should be seen as a public good that's accessible to all and available in an equitable way. That is not the current system. We have a fragmented patchwork of care that is absent in many of our communities and certainly not sufficient in others. Third, and consistent with the second one, is we need to shore up our workforce. We have not held health professional schools accountable for training the primary care workforce that's needed for providing the numbers and the skill sets for all of our communities, including those in frontier rural communities, inner cities, suburbs, and everywhere in between. Fourth, we need to liberate our teams to deliver creative care in different models with different payment systems that fit within their patient population and their community. We cannot continue to pay for one service at a time with our fee-for-service model. We need to liberate our teams to be creative in delivering care and paying for care as needed for those communities. Fifth, we need to support our teams to identify and address social care needs, the social determinants of health in new and innovative ways, and have this integrated directly into primary care as well as all other aspects of healthcare. Sixth, we need to measure what matters. There's a lot of measurement happening right now, and much of it doesn't matter to health. So we need to really get laser focused on measuring what matters. And seventh, and arguably one of the most important tenets and the secret ingredient to primary care, is continuity. And we need to preserve and strengthen continuity. And getting back to the story about the patient that this whole article was inspired by, it was the continuity, it was the relationship that our team had built with her, the time that I had spent with her, that helped me recognize that she had had a change in her condition and was in need of emergent care. And this is critically important. And again, one of the reasons why I believe primary care does save lives is we build continuity, relationships, and spend time over a lifetime with patients and communities to be able to help support their healthcare needs and their sick care needs. And so this is one of the areas that I feel is extremely important for primary care. So in conclusion, please read this very short article. It's easy for anyone to read, whether you're a patient, a healthcare professional, researcher, policymaker, to really understand at the very front lines what patients and primary care teams are experiencing and how we can get this very critical intervention, life-saving intervention, off of life support. Thanks so much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.